The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. Bill Latimer. I am so excited to have Dr. Philip Leaf, professor in the Department of Mental Health at Johns Hopkins University, Bloomberg School of Public Health, and the director of the Center for the Prevention of Youth Violence as guest on our program today. Let's kick it right off. Welcome, Phil. It's great to have you on. I know you've been doing some work on the impact of trauma on the lives of children, adolescents, families across the lifespan, and one or two things that we probably should be doing to respond to trauma. Why don't you set the stage for us?
Great. Well, thanks very much for having me here. And so I think we've all experienced trauma through the COVID epidemic. That we've done things, we've seen things, whether it's our friends or other things that we never would have experienced before, couldn't even imagine 18 months ago. So part of what trauma is the events, the experience, and the effects. Obviously being exposed to trauma, some cases losing our jobs, having to work from home. My wife's also working from home. We've all had to make these accommodations. Sometimes it's a single thing. It could be physically, emotionally harmful or life-threatening, or it can just be a change. And that one of the things, though, that we also need to appreciate is that we experience trauma over our entire lives. And one of the things is that a lot of children from birth have been experiencing trauma. And then when they come into something like a COVID, they're needing to deal with those kind of things. And that exposure to trauma, we know, have long-term impacts, but they also have short-term impacts.
Very good. Tell us a little bit about, so Phil, you know this because I just told you, I was moderating a roundtable where a number of young people were describing their experiences. We didn't ask them specific questions about trauma per se, and yet they talked about some incredibly heart-wrenching experiences. One student had lost a grandparent to COVID, and another had lost a very dear friend to suicide. When you say trauma, to me, those are traumas. What are the kinds of things that are on the list that qualifies as trauma? And is that different than the kind of day-to-day stress that we might experience, whether extreme or less extreme? Is that a fair question?
Sure, no, absolutely. And so trauma is a part of stress. And that the reality is, going back to when we were living in caves and on the ground, the stress was was an important part because there was a flight or fight movement. And that, if there's animals coming after you, you don't want to be thinking about what I should be doing next. You just zip out of there. Or if you can't get out there, you start fighting with them. And that's sort of what we do all the time. And what happens, though, is if the traumas continue, the stress continues, it becomes something like we call chronic stress. It doesn't alleviate ourselves. Part of the fight or flight is getting us out of there, so we then get out of that stress. We may be tired, but we return to our normal existences. And it can be everything from, obviously, the COVID. In some cases, it might have been a short term or a long term. But as you said, we've had, particularly children, have had grandparents who were very healthy. In some cases, who were raising them, who they saw every single day, all of a sudden get sick and then die. And one of the things that happened is they couldn't even be there to say goodbye. That one of the traumatic parts in our communities is the clergy haven't been they've over thousands of years generated ways that they personally dealt with these traumas. I mean, they've always been called to deal with people who are dying to make it easier for them and for the families. But that was seeing them and doing stuff in person, and they couldn't even get into the hospitals or into the nursing homes anymore. So that this trauma has been doing, a lot of different things, and that we have the historical traumas, the racism, poverty, slavery, Holocaust, the community level traumas of which COVID is. That's not just affecting us as an individual, it's affecting our entire community. There's former trauma, former accidents, or not, having your parent incarcerated. Well, they got incarcerated a long time, but you as a child are dealing with this, or sort of an acute thing. Those are all things that are going on, and we've just had much more of those recently. And I think, as you mentioned, a lot of the things that often the school is the safest place for the child. It's where they've had their supports. It's where they see their friends. If they have some skills and athletics, it's what they were doing, those things. It's how they were getting their personal reinforcement. And all of a sudden, they couldn't get into the schools. They couldn't do these things. They've been dealing those things. And one of the interesting traumas that got accounted for that we've talked to young people is, it's one thing to try to do your homework on a computer, but they didn't realize how much they learned being on the school bus, going to the school, or walking to the school, or at lunch talking to these people. They talked about their school things and other things at life before, and all of a sudden they didn't have that anymore. So they had a lot of things that were part of their natural strengths that just removed from them, not because of anybody's fault, not because of anything they did, because of COVID. And now we're all struggling, and certainly the families and the other things have struggled with, okay, how do we replace those things? And now schools as people are coming back in the Bronx and other places, what are the schools doing to accommodate these things, to make sure that the children and also the staff, I mean, the teachers and people have had their own children that they've had to deal with this, as well as how, they've had losses of their parents and grandparents. So this has been a very traumatic thing. And I think the one positive part is, because of these Zooms, as we're doing the Zoom thing here, I don't know how many times I've been in meetings and somebody's child sort of walks into the meeting to talk to the parent, or the parent says, wait a second, I'm not hearing my kid talking anymore. I'm not hearing them practice their instrument. Hold a second. Or I got to make lunch for my child. It's 12 o'clock. Sorry, I got to stop for a minute to get off the screen to do things. We've learned much more about our colleagues' lives and other kind of things, which I see this as a positive thing, because we've had to make accommodations in how we're functioning. And I think the challenge as we move forward is, how are we going to create these healthy environments, whether they're school or workplace environments, so that these accommodations that we've made that are positive, how are we going to now get those into and continue those things?
So, Phil, you have written about how to make healing-informed environments in response to trauma. How do we do that as students are returning to school? You mentioned that is a critically important environment. So either within schools or elsewhere, what are some steps that we should be taking to make that return, to utilize it as an opportunity for healing, as opposed to perhaps a return to some processes that might not have been ideal?
Well, so one of the things that we talk about is, how do we change the conversation to what's wrong with you? Why are you misbehaving? Why didn't you get your homework done? To what's happening to you? What's going on? It's trying to be empathetic, the same thing we would be doing with our own children or with our friends and our neighbors. We need to take that back into the environments we work, whether it's our workplace environment or whether it's a school environment as a teacher. And I think it's going to be easier now because people know that the challenges that their own children have had dealing with some of these things. And hopefully we'll all be a little bit more accommodating because we've recognized we've had to do some of these things. But it's also taking a little bit of time. I know one of the rituals that we've built into a lot of our meetings now is we go around and say, how are you doing? Anything happened to you? Are things going okay? We have to make sure the schools also do that. We're reinforcing people to let us know what's going on, how things are going, and trying to make accommodations to make these sort of healing environments, positive environments, even if they are meant to be academic or learning environments or work environments. And I'm hoping, because we've had to do these things with the virtual world, many of us, that we will be able to make that a translation to make this more welcoming, more nurturing, and more positively affirming for folks for doing these things. And also reaching out to ask people, what could we be doing? What can I be doing to help? What would be helpful? Not assuming we have the answers all the time, but what could be doing? What is it? How can I help you? What could be going on? And I think that getting back and increasing our relationships, whether with students or colleagues or other things, is going to be one of the things that is coming out that we need to purposefully do and move towards. How do we create healing activities, supportive activities, in addition to our educational activities or our training activities, or doing all these kind of things? And maybe none of us are going to be having workplaces, classrooms that are looking the exact same way as they did before, but hopefully they'll actually be more positive and more affirming for the individuals. And getting the youth, again, more involved in helping create their own solutions. I think we've had to do that with our colleagues. We've had to ask them, how could we be helpful? Well, certainly with schools or other kind of things, asking the young people themselves. And I'm always amazingly impressed because I'm like an old guy and don't necessarily understand all this stuff, how young people can really translate what's going on and how I could be helpful, or how other people, they're not in other worlds. They really are very practical people. They come up with much more practical ideas of things we could be doing than we academics usually come up with. So again, I think having these conversations, talking and listening are really the important pieces.
Your points make me think of a lot of things. We've got a couple minutes left. Let me ask you this. I have quite a few public school teachers in my family, and sometimes they understand, but lament the kind of focus on testing and test scores, the pressure that principals are often under to have their schools perform at a certain level, or they could lose their jobs. This is a two-part question with not a lot of time left. How do we infuse that culture of empathy and a healing environment within a public school system that has that kind of pressure? And then second part of question, and I'm not an expert on this, but I've read about how there has been a kind of explosion of mental health issues and needs in K through 12 through higher ed, and that the system just isn't fully equipped to respond to it. So where do we intervene? Are we intervening with superintendents? Are we intervening with commissioners of education at the state level? How do we move the needle forward?
Well, we're intervening at all levels, and we're working at all levels before. I think it's going back to not blaming the child or blaming the teacher or blaming the principal because things are not going well. It's trying to say, what is your structure? That some people live in environments and neighborhoods that have less assets and less resources. We have Baltimore City actually has the second longest commuting time for any place in the country. It's second only to Los Angeles. Everybody always says, "Oh, Los Angeles, I know about the backed up freeways," but nobody would think that it takes on average time to get to a job in Baltimore longer. Well, it's because we don't have good transportation and most of the jobs are out of the city. But that means we don't have our parents have to wake up and be out of the house by 7 o'clock before the children leave. They're not there when the children return. So we need to figure out, that's why we've created increased community schools and after school activities. It's sort of saying, what are some of the accommodations that we had to make in the virtual world or the mixed world? And are some of those things we could be building into our classrooms, into our schools? And how do we go about doing that? But also, how do we make sure that the teachers aren't getting stressed out, that the principals aren't getting stressed out? How are we positively reinforcing them? Because again, a lot of times we all get, again, with the test, very often we'll get sort of criticized or immediately, dealt with if we didn't do a good job. But nobody's talking about the children that are doing better. And, and one of the projects that we do, and one of the things that we do, is we always talk about positively reinforcing the student. So a student who, was being disruptive and was doing a little bit better today, you might want to talk about them. And I don't know how many parents I know that say the only time I've ever heard from the teacher of the school is when Phil's misbehaved, when Billy's misbehaved. The schools, if you positively reinforce one, so we need to also figure out how are we positively reinforcing students and other folks.
Great. So clearly a lot of work to be done after a pretty extraordinarily stressful year. We're going to be taking a quick break. We'll be back in a moment with Dr. Phil Leaf, who is going to tell us a little bit about his personal and his own academic journey that landed him the faculty position at Hopkins, where he has been able to really move the needle on so many levels and carve out a professional career. This is Public Health America. I'm your host, Dr. William Latimer. Welcome back to Public Health America. I'm your host, Dr. William Latimer. We're here with Dr. Phil Leaf from the Johns Hopkins University Bloomberg School of Public Health. So Phil, part of the second segment, what we're trying to do is, I remember when I was in high school and in college, I would meet people like you and I'd be like, wow, I could never do that. They're so smart and they're so accomplished. And part of what I want to try to show our viewers is that everybody's a human being. Everybody's faced challenges and met those challenges in order to get to the next level, and maybe to provide a little bit of guidance on how a young person or any person of any age can get to, maybe get back to college or get to college, and that's a really important aspect of moving one's professional life forward in terms of a career as opposed to, say, a job. So with that said, Phil, tell us, what were your formative years like? Where were you born, and what was going on?
Okay, well, I was born in Manhattan, but I lived the first 6 months of my life 2 blocks away from Yankee Stadium. So I'm from the Bronx.
There you go.
We moved to Kew Gardens, and then when I was 6 years old, I moved out to Long Island and was there till I went to college. So some of my earliest remembrances, my father was a candy wholesaler. And one of my earlier remembrances, so we always had great candy for Christmas parties and birthday parties. But one of the first, when I was in kindergarten, he brought a whole bunch of food, candy, and we had a kindergarten program for children who were deaf in our elementary school. And he made sure he gave them some food and some candy, and said that that's what we do. So that's actually one of my earlier remembrances. Also, I failed spelling and math in 5th grade, and got into trouble for behavioral things in 4th grade, and was actually got to sit next to the bully because I screwed up all the stuff and stepped on all the stuff we were making in class. And so the bully and I got to be friends. But I point this out is that this is before people learned about attention deficit and dyslexia. I still can't write. I still can't. I transfer letters and numbers all the time. Have no ability to write. I have to have people, even when you spell check, if the word's a real word, spell check doesn't catch that, even though it's totally the wrong word for there. So I just want to say is that some of us who, again, I work at Johns Hopkins, which is a pretty good school. I also worked at Yale. But I went from high school, I went to the State University of New York at Baltimore, because that was the farthest away university in the state, and we couldn't afford, spending much for tuition and things. And at that time, I think with the tuition, New York State Regents Scholarship, my tuition was going to be $25 a year. And I went away and became involved with student government, and found out that I can actually get free, if I get into the student government, I'm going to get free meals, and then I'm going to actually get free meals, and they're going to pay give me a stipend and stuff. So I was both residential government and was vice president of the student association. But two things that I remember doing there was one, and this was sort of 67 to 71, there weren't a large number of Black students at SUNY Buffalo. And the residential students, the Black students, particularly the Black males, wanted to have a facility where they could be with themselves. And so since I was the president of the Student Residential Association, I advocated and was able to get them part of the campus. And these are like apartment buildings that, like 2-story apartment buildings, that they had a series of them so they could be with themselves. The other thing I did was I actually wound up eliminating our football team because we got control of all the student funds. Not very many students went to football games. And so I decided that, that's not a good use for our money. We'd rather be paying for movies and other kinds of stuff where they were used. So I pulled the student stipends. And I think Baltimore then went to Division III, and it was probably 10 years before they went back to being Division I in terms of getting their things. I just point this out, that students, it's an important thing for learning, but actually you also have power as a student. You are the main consumer of that institution. I probably shouldn't be talking to Dr. Latimer about that as a president of a university, but there's lots of powerful things you can be doing while you're a student. And then some of the advocacy groups, we actually the school closed down 2 years, so we didn't have finals for 2 of the years because this is when the uprisings were. And my roommate had the bail fund, so we actually would go out and bail out students using our student money to bail out people who got arrested. Wow. So that's sort of one of the things I did. But I also, when I went to SUNY Buffalo, went to Wisconsin as a graduate school, and went and did my dissertation, and I drove around Alabama for a year and a half interviewing ex-patients. That was my my dissertation, but I also wound up meeting my wife, who was a clinician in the juvenile unit half-time and the adult correctional institution at the psychiatric hospital there. So you wind up meeting people that are wonderful, and she's a lot smarter than me and a lot nicer than me. But she's I wouldn't have met her if I hadn't been doing these academic things. And so I raise these things because even within academics, you can be doing positive things. And this was sort of a career that I've taken. And I've continued to be able to raise money, write these things. And so currently, I'm actually the secretary for something called the We Are Us Men's Movement, which actually was brought together by the Nation of Islam and a number of churches. I'm not a Catholic, Christian. I'm actually Jewish, but I definitely probably don't look like I go to the Nation of Islam. But they've accepted me, and we do work together, and the same thing for other kind of things. So I think you're able to take the assets in the institution, as you might as an employer or other things, and work with real people in the community to try to benefit them.
That's great. Phil, what a great story. And we're going to run low on time, but I have to comment on a couple things. The story about later elementary school with difficulty in language, I didn't realize that we shared some of that in common. And yet, I never would have guessed that about you because you're such a phenomenal writer. But I want to make sure that I don't end this segment without saying what I'm about to say. So when I joined Johns Hopkins in the department where you are, at the very beginning of my career there, you covered my salary for a period of time, which I very much needed. I've never forgotten that. And you were the guy who would say to me every other week, "Oh, I'm visiting the governor, I'm visiting the mayor, I'm visiting Moses. Would you like to come along and meet them and maybe be a part of the team?" And so I learned so much from you at that phase of my career, and I want to thank you. Also, by the way, I'm not a president; I'm the vice president. Just for truth in advertising. Phil, is there kind of a, you've said so much, is there a final thought that you would give to our listeners about, you overcame stuff in elementary school, you went to a public university because it was affordable, even though it was a great school. What's one or two things you would say to our audience to get them to college? What's going to get them there?
I think it allows you to fulfill your visions. It gives you sort of opportunities while you're a student, not necessarily learn stuff to do later on. It provides you, because through other students and other kind of things, as well as it provides contacts and relationships. I'm still friendly with some of the people I went to undergraduate and graduate school with. And so again, it provides you with other folks who are like you and who you can do things with. And so I think again, it's hopefully positive, but there's also options there in terms of being able to generate resources. Again, as I said, I generated things so that allowed me to stay there and over the summer and other kind of things, because there was a way of funding that. There are ways of getting work studies and other kind of things that allows you to, once you're in that environment, to be able to cover some of the costs that you wouldn't otherwise be able to cover, and without borrowing huge amounts of money.
Wonderful. So I want to thank Dr. Phil Lee. Phil, I want to thank you. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time here on Public Health America.